Welcome to the Eyesight Insight podcast with Eye Care Center of Ocala. I'm Cassidy Mars, joined today by Dr. Stephen Shaw of Eye Care Center of Ocala. Dr. Shaw has been practicing optometry since 2008. Prior to this, he worked as a meteorologist in North and Central Florida. After deciding meteorology was not the field for him, he returned to college to prepare for optometry school, with a detailed focus on ocular disease management, primary eye care, low vision, and specialty contact lens fittings. He met his wife, Dr. Shuko, in optometry school in Philadelphia, and they are now co-owners of Eye Care Center of Ocala. Today, we'll be discussing age-related macular degeneration and the importance of early diagnosis. Dr. Shaw, thank you for joining us today. What is macular degeneration?
Hi, Cassidy. So simply, macular degeneration, it's a retinal condition that leads to loss of central vision.
I've heard that there are two different kinds of macular degeneration, wet and dry. Can you explain those a little bit?
Sure. About 90% of patients with macular degeneration have the dry form, 10% have the wet form. Really, the difference between wet and dry is the presence of new blood vessels that develop under the macula. The blood vessels form under pathologic conditions. They tend to leak blood, and that can be devastating to patients' central vision. The other form, the more common form, is the dry form. Can also be devastating. That involves the buildup of metabolic waste, which is a byproduct of photoreceptor metabolism. And that can eventually lead the macula to atrophy.
And how important is early detection of this pathology, and how do genetics play a role in this?
Oh, that's a great question. So macular degeneration is definitely more common in older individuals, let's say over the age of 50. Tends to affect Caucasians more so than other races. Genetics do play a role, as well as being a smoker, former smoker, being overweight, having heart disease, high blood pressure, high cholesterol. One of the earliest symptoms is difficulty seeing in low light conditions, such as driving at night or reading in dim light. The early detection is so very important to protect your vision. The best way to do this, obviously, is to see your eye doctor every year for a dilated eye exam. If you know someone that has macular degeneration, you'll probably notice one of their eyes is worse than the other. The reason for that is because it was too late to intervene when that person probably realized they had a problem to begin with and then sought care for their vision issue.
So what are things that people can do that can help slow the progression of macular degeneration?
Well, one of the things that we do in our office, and let me just say that we're one of 10 offices in the state of Florida that have this device called the Adapt DX. What that does is it measures how quickly your eyes adapt from light to dark. It allows us to quantify the symptoms of macular degeneration before it clinically appears in the eye. So we have the ability also to perform genetic testing in the office that not only looks at how many genes you have associated with macular degeneration, but also the likelihood of developing to more advanced macular degeneration.
There's some great tools to have in office for that. What about anything that they could do at home to help with the progression or monitoring their symptoms?
Sure. So monitoring, when we have patients that develop macular degeneration, we'll send them home with something called an Amsler grid. It's a way for the patient to self-monitor and look for changes to their eyes, which can indicate worsening of the macular degeneration. We now have the ability to send a patient home with a device called the 4C Home. It's something that's covered by most insurance plans, and it's more of an advanced form of an Amsler grid. The device connects to the internet and would report back to our office when the patient is doing the test. And if there's any changes, it allows us to intervene a lot quicker. Treatment options, lifestyle modifications, not smoking. There are different eye vitamins. Patients have probably heard of the AREDS formulation. There's also supplements like lutein, zeaxanthin, mesozeaxanthin, which also can help as well.
That's awesome. Definitely having the in-home options definitely gives patients a peace of mind, which is great. What does life look like for someone who has macular degeneration after they get a diagnosis? What are their next steps?
So depending upon the severity of the macular degeneration and the type, whether it be the wet or dry form, we'll definitely follow up with the patient more frequently, at least twice a year, sometimes more if worse. If that patient develops the wet form of macular degeneration, at that point we'll refer out to a retina specialist, and they would probably need injections at that time. In terms of things that we can do to help them while they're at home when they develop more advanced forms of macular degeneration. There are some low vision devices that increase the magnification of what they're looking at. Like when we talked about the central vision being affected, magnification kind of tends to magnify an image so that it's large enough for the patient to kind of put together. But that's really it in terms of what we can do post-diagnosis.
That's really great. So really the key to early diagnosis and treatment of macular degeneration would be keeping up with your yearly eye exams and just being cautious of your family history and knowing that there is options and treatments available.
Absolutely. And like I said before, smoking is probably the worst thing you can do. I'm going to step back and mention the genetic testing we talked about. We've done plenty of genetic testing on patients, and genetics do play a role, but environmental factors such as smoking, being overweight, high cholesterol, high blood pressure play a much bigger role than your genetics do.
At Eye Care Center of Ocala, you will find a caring team of professionals dedicated to providing high-quality, personalized eye care for the whole family. For more details on the information shared on today's podcast, we'll post a link on our social media. If you have any questions, please feel free to contact our office at 352-512-0560 or visit us online at eyecarecenterofocala.com. We hope you enjoyed the podcast. Thank you for joining us.